The Awutu Senya Health Center in Awutu Breku in the Awutu Senya district of the Central Region is one of the centers to pilot and implement the malaria vaccine RTSs or Mosquirix. The health center serves over 30 communities in the Awutu Breku catchment area in the Central Region. In 2019, the center recorded 603 under 5 malaria cases, 710 cases in 2020 and 311 for the first quarter of 2021.
We are not getting the numbers that we used to get last year because our interventions are working. The vaccines, we are giving the vaccines. We are giving out mosquito nets. We are educating them on personal hygiene, and it is helping.
The malaria vaccine is an add-on to the numerous malaria interventions being implemented by the National Malaria Control Program, NMCP, and its partners in Ghana. Introduced in 2019, the RTSS vaccine is being piloted in 7 selected regions in the country. It is administered to babies at 6 months, 7 months, 9 months, and 24 months. RTSS is the first and to date the only vaccine that has demonstrated it can significantly reduce malaria in children. However, the challenge is the prompt and continuous visit by caregivers to the health post for the 3rd and 4th dose.
Okay, we have a defaulter book that we use to trace those who do not come for the last dose. So what we do, we take their numbers and then we try to get their address, and then we do intensive home visits to be able to get them.
For instance, we had 7. It's because of the COVID. That's why we had 7. But at times we record about 15, 20. From the beginning, it was hectic. But through the home visits and the health education that we are given, in fact, it has helped us.
Another selected health center for the vaccine is the Bodrasi Polyclinic in the Awutu Senya East District of the Central Region. The facility, which is the only government health center in Awutu Bodrasi, serves over 80 communities from Ofako, Bodrasi, Shredru, Senya, and some adjoining communities from Adaiso. The center, which used to record positive under 5 cases in the thousands, now records cases in the hundreds. Authorities say malaria death rates have gone down with the use of various malaria interventions.
Looking at maybe the number of episodes a child would have gotten malaria. If a child would have gotten malaria 10 times, RTSS has helped to reduce it to 4. And that is why we call 4 intense. And looking at 3 intense, we are looking at children who would have gotten severe malaria 10 times. They are able to get it, even if they are able to get it, it's 3 times. So RCSS has really helped, coupled with other interventions, which is the LLIN, the residual sprayings, and the rest. RTSS has really helped.
For the health directors in the Awutu Senya East District, the vaccine should be implemented in other districts to reduce malaria cases.
We looked at under 5s that presented for care and were suspected to have malaria. And we realized that over the past 2 years, the numbers decreased. For us, we think that the malaria vaccine has brought about some change in our malaria data. It has brought about some impact. And for us, we think that it should be rolled out to other districts.
For the health service, all our interventions are proven, So once even though it's proven, we pilot it and it's having good positive effect, then we scale up. So that has been the trend over the years. And then also the use of the nets. It's one of the proven interventions we have. But people collect the nets and they don't use them. So we also want to ensure that people actually use the nets that are given to them. And it's given for free.
Ghana is one of 3 African countries, including Kenya and Malawi, in which the vaccine RTSS is available to children up to 2 years of age. For GBC News, Mavis Ofe Champong reporting.